Focus on Abilities is brought to you by Tier Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. In the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.
Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden. I'll be your host for today's program. I'm professor at the University of Texas Health Science Center at Houston, and I direct the ILRU program at Tier Memorial Hermann. We have an interesting guest for you on Focus today. We also have a question that we'll answer before the end of the program. That is, 2015 is the which anniversary of the Americans with Disabilities Act. In 2015, we celebrate an important milestone in the ADA. Which anniversary will that be? We'll answer that question, and we will meet our guest in just a moment. Thank you so much for joining us today for Focus on Abilities. We have a special guest with us, and I'm happy to introduce to you Merrill Friedman. Merrill is the Director of Public Policy or Policy. How do you describe your title, Merrill?
So the official title, you can actually use anything you want, Lex, because I'm thrilled to be here, is Senior Director of Disability Policy Engagement for Anthem.
And that means you're involved with advocacy, you're involved with policy, you're involved with issues like the ADA, you're involved with lots of disability groups around the country. What else?
So I support a lot of our health plans. We make sure that our health plans are working with people with disabilities and older adults to inform the programs and make sure that our programs are meaningful to the people who benefit from them and who use them. And we work with our business development teams, because we do have several, responding to requests for proposals that the states issue, so that our recommendations really do reflect the preferences of people with disabilities and their families as states develop new health care programs.
Now, I referred to your title as being disability policy, but in fact you are a disability policy expert, regardless of the title that you carry in your job. We want to talk some about that, but before we do, just to clarify for the audience, the company you work for is Anthem.
Correct.
It's a multi-dimensional health insurance company, and they have programs all over the United States, different kinds, managed care programs for employers, and so on.
Yes, and most of the areas that I focus in, although I've recently, in the past year and a half or 2 years, gotten more involved with some of the commercial business, but I've spent the last 8 years focused on our Medicaid programs, and so we have in those programs now we're in about 19 states and serve over 5 million and support over 5 million individuals, and have about just over 418,000 members with disabilities and older adults who access their health care services and supports through us.
Wow. Merrill, the context in which I first met you and the context in which we still enjoy working together is that of the National Advisory Board for Anthem. The National Advisory Board is a group of about 13 people, 14 now I think, who advise the company on different issues pertaining to disability policy and advocacy primarily. And we are happy to have the opportunity to work together with you. You are, I would say, the liaison with the company. How much of your time do you actually spend with us? I'm curious about that.
It's interesting. I think it's changed. It's evolved over the years. But maybe, I think formally as a group, 20% of the time. But fortunately for me, I get to work with so many of you in the communities and on a national level, independent of, if you will, the National Advisory Board and some of your colleagues and my colleagues in their capacities, their non-advisory board capacities from the organizations they represent. So that's probably 90% of my time.
Well, I mean, that is kind of an extension of your own self, the national advocacy. And I think that's the other role that I would define you in, and that is one of a national disability advocate. You have the opportunity, you have the benefit of sponsorship by a company to be able to travel to every state all over the country and meet with disability groups, learning what issues concern them, and to the extent you can, trying to help them resolve those issues. And they're issues not pertaining necessarily to your employer, but just advocacy-related issues, right?
You know, I think there are a lot of issues in the changing landscape of managed care or health care services. In so many of the states, well over half of them are looking at long-term services and supports. A conversation you and I and the board we have often. And so I think there are so many issues, social determinants, voting, transportation, housing, that really are part of people's overall health care. So they are advocacy efforts that may not be directly related, but I think really for people they are directly related.
See, that's an interesting point that I'm not sure we think about usually, and that is that it's in the interest of our healthcare providers, whether that be our health insurance company, our doctors and nurses, whoever it may be. It's in their interest to make our interest as healthy as possible. I mean,
Right.
if we are healthy, then they're achieving their objectives, right?
Right. And I think that's important. I think there's been, you know, a whole expanded focus even lately on the health benefits of people being able to attain employment. And so I think those dynamics are changing in states where healthcare organizations are really being held accountable as a partner with, you know, VR, Voc Rehab, and advocates and other businesses to ensure that our members have access to employment. It becomes part of their service plan.
Well, health and wellness programs are relatively new on the landscape, and companies are promoting those, both employers and health insurance companies and the government, promoting wellness programs so that people pay attention to their own good health. Preventative medicine is another approach. I just the other day from my health insurance company got an email asking me if I had had this checkup and that checkup and so on. And my first thought was, do they know something I don't?
Right.
You know, do I have something I wasn't aware of? But then it occurred to me they're just trying to make sure that if I do have anything, someone catches it early enough to do something about it.
And to be able to engage in that dialogue and have connection with our members, because we can ask if they've, you know, had a checkup, if they've been somewhere, but the follow-up question is, do you have transportation to get there? Right, you know, and do you have supports to go with you? Because that's part of, you know, their healthcare service benefit, I guess.
Well, I think the whole issue of health care for people with disabilities is important, and I guess in the work you do, certainly the work the National Advisory Board does, it becomes paramount. If people aren't well, and particularly people with disabilities, it's hard to work, it's hard to find a job, it's hard to keep the job.
Right. And I think, you know, we've talked before, and it's a big conversation. It's very important. The President's executive order supporting, you know, employment for the government and for people with disabilities and for private businesses as well is to really focus. We know that the employment landscape is difficult for everybody, but it's certainly difficult, and there's a considerable, you know, disparity and barrier for people with disabilities. And so what we can do to, you know, as we get to know our members and we work with them to develop their service plan and their self-directed options, you know, we ask them where employment fits in. Are they interested, you know, in being employed? And as, you know, some of our service coordinators say, you know, we don't get the choice. Nobody, you know, we should all work, right? It should be, you know, it's everybody's, you know, obligation to work, but it's most everybody's preference to work too. And so where we can support that, we know that that creates better personal health outcomes for people, but certainly meets those state outcomes that they're looking for as well.
Let's talk more about that, but first I want to take a break here. I would like for everyone to stay tuned. We'll be back with more of Merrill Friedman and Focus on Abilities. Be right back. Welcome back to Focus on Abilities. I'm Lex Frieden. We're here today with Merrill Friedman, a national disability expert, and Merrill works in the areas of policy and advocacy, and it's hard to really know what to call you, Merrill. You have such a broad swath of issues that you cover and things that you do. Frankly, I can't imagine trying to keep up with you. You travel a lot. You get a whole lot done. I've never known anybody who can multi-process as well as you do, and I've often seen you carrying multiple PDAs and smartphones and actually using them simultaneously, which is a remarkable trait. How long have you been able to do that?
You know, I've always been a multitasker. It actually helps me to focus, but I think I'm honing those skills more and more over time.
It's phenomenal. You said it helps you to focus. Mm-hmm. You have particular issues with focus?
I do. ADD has sort of always been a part of my space, and so if I'm doing more than one thing, I focus. Oftentimes, I can't completely deeply focus on two issues at the same time, but if I'm completely focused on one and doing something like a puzzle, you know, or a simple task, it actually helps me to focus.
So I'm just curious, how does that, what happens if you don't do that? What characterizes a lack of focus? So you still may be trying to pay attention to the one thing, but the other part of your mind, the vacant part, is actually wandering around looking for something to do.
Yeah, planning dinner menus.
So it's,
or my next,
it's more, that's an adaptive technique you've just adopted. When did that occur to you? Did somebody suggest it? Was that somebody's recommendation, or you just acquired that skill and discovered it was functional?
You know, I think probably 8 years ago when I joined the company, we spent a lot of time on conference calls, which many companies, we all do it, organizations. Sure. And when you sit on conference calls, if you really pay attention to the subject matter, you really can't write a meaningful document necessarily at the same time, or an important email. And so it was a way of finding that, you know, those things that I can do that will help me focus on just, you know, the voices over the phone, so to speak. And it was just something that came about through that process.
Well, that's interesting. Have you ever suggested that to somebody else whom you might know with ADD?
I do suggest that to people.
And what's their reaction? I mean, do they try it? Does it work?
Some people say yes and some people say no. Right, so I think everybody's very individual about that, what will work for them. But we all continue to try to do 2 important tasks or 3 important tasks at the same time. I think that's where most of us get tripped up pretty quickly.
Well, yeah, we all try to do that, regardless of whether we've been diagnosed with ADD or not.
Right, it's survival.
Merrill, before the break, we were talking about employment of people with disabilities. And to answer the question that we asked at the beginning of the show, this 2015 will be the 25th anniversary of the Americans with Disabilities Act.
Wow.
The ADA never was intended to be an employment law for people with disabilities. There's no affirmative action provision in it or anything of that nature. However, we did believe that by leveling the playing field, by removing environmental barriers, by requiring attention to equal rights, by prohibiting discrimination, we believed that employment rates among people with disabilities would naturally improve. And at that time, the rate of unemployment among skilled, ready-to-work people with disabilities, as I recall, was about 80%. In other words, 1 out of 5 people who wanted a job could get one, which was terrible. And we thought that the ADA would have some secondary impact on that. But in reality, when we look at the data today from the Census Bureau and the labor statistics, we just find almost the same horribly high rate of unemployment of people with disabilities. What do you think about that? What causes that? What's the dynamic factors at work there that prevent all of the progress we've made in barrier-free access and accommodation from influencing that employment rate?
So there are probably so many factors that we won't get to all of them, but I do think a couple that would come to the top of my mind. One is just our economy, and jobs. We know jobs are out there, but a lot of people are vying for them. People are working later in their lives and not retiring from jobs quite as early. But I also think we have cultural issues in business still, and I think there still needs to be a lot of training with companies and employers about the abilities of people with disabilities and how really simple it could be to make accommodations in the workplace. They are usually not significant. I think there's still training. I talk a lot about our mid-management. I know in our company and other companies, senior officials and leadership are very supportive of diverse workforces and building opportunities for people with disabilities to be employed. And I think we talk a lot about it, but I still think we need to train managers on how to accommodate that and assimilate that in the workplace.
But, you mentioned your company. I don't know what the employment rate there might be, but I know in the federal government, which has really tried to promote, the president's tried to promote, the president before this president tried to promote, everybody tries to promote employment of people with disabilities, right, at least back to 1990. And yet, the percentage of people with disabilities employed in the federal government still is around 5%, which is not anywhere near the proportion of people with disabilities in the general population. So it seems like however hard we try, we haven't found the magic that gives us a breakthrough for hiring these people. Do you think that by any chance is prejudice still involved here? You mentioned culture, but does culture then define prejudice that may be determining whether an employer will hire a person with a disability when somebody else is in line who doesn't have a disability?
I think it sure can. I think, that's such a one-by-one, sort of influencer out there. And I think we're also still trying to build, culture within the companies so people do self-disclose, because as we know, not all disabilities are visible, and so we don't always have maybe what is an accurate count, but I think we all agree it's abysmally low, and it's disturbing. And so I think, over the next many years we're going to be working through this. So I think prejudice is difficult. I think it's difficult for people to disclose they're not comfortable. I think we still need a lot of work around understanding what are accommodations. I do believe that we focus a lot on culture, and we're not always so focused on what accommodations need to be made and how many of them, whether they be software and technology or physical accessibility, really can be accomplished very quickly.
Well, a minute ago you mentioned what I believe may be an important factor in erasing any prejudice that's out there, and that is education. I think we need to do more education with employers, and we've done a lot. But I don't think you can do too much in this area. So that's one thing I know you're engaged in, and I really appreciate that. Let's talk more about that, but first I'm going to take another break here and ask you all to stay tuned. We're having a great conversation with Merrill Friedman. We'll be right back. This is Focus on Abilities. You're here with us in the HTV studios in downtown Houston. I'm Lex Frieden, and our guest today is Merrill Friedman. Merrill, we talked before the break about employment of people with disabilities and education. Companies are doing some interesting things, some things that we could regard as best practices. Is Anthem fit into that category?
Sure. Thanks for the opportunity to talk about that, Lex. I think we've been working on it for some time. I think it is an evolving process. As you know, our company has grown, through several acquisitions, and so we're educating more and more people. I think, some of our success in building our culture out and understanding of the value of people with disabilities being included in our workforce, aside from the fact that we should do it, is the benefit of people being able to hear from the National Advisory Board, that we talked a little bit about earlier, as well as other colleagues and friends of ours from the community who have come in and met with, our diversity and inclusion, our talent acquisition teams, our executives, our service coordinators. So we really try to approach it from helping our members gain employment, as well as building our own workforce within the company. And we've made several strides. We've put together recently a diversity council within the company by your friend and colleague, Pete Haitayan, who's the president of our government business division. He leads that. I'm fortunate enough to serve on that with him. And really looking strategically how we can have a fully diverse workforce, including people with disabilities, people who are LGBT, people who are African Americans. So our workforce and our culture should change dramatically, and we're doing that from a senior leadership advantage, which is really wonderful. And then we also do it from our service coordinators. We hire people, some of our members, people who are on a Working Healthy program and Medicaid buy-in program. So we're really trying to come at it from multiple angles. But it really does come back to the education, and we still have a lot to do in our company and with our colleague companies.
But I think the systematic commitment to improving employment rates among the company is really important. And with your leadership and that of Pete Haitayan, who's, in my opinion, really a great advocate, it's wonderful to have somebody with his kind of inspirational leadership and understanding of these issues at a high rank in a company like this. So I have very high expectations, as does the National Advisory Board, and
Exactly.
You know that we will be holding you accountable. The first meeting we had, which was nearly 8 years ago,
That's right.
that was one of the first questions the board asked, is what's the status of employment of people with disabilities in this company that's actually serving many people with disabilities? Are they actually working in the company? And I think that since then, your company's been sensitized to that. We actually are anxious to see progress that I know you'll be eager to report as soon as you can.
Exactly, and it's been quite a process. There's been a lot of education, and as people change within the company, you've had to educate new people, and I think we're truly at a point where we're really moving the needle. I think the energy around the 25th anniversary of the ADA also brings some added light to it, and people are focused on what people expect from the ADA, what they've seen over the last 25 years, and what they expect going forward. I think young people with disabilities, their expectations are going to be much higher of us, and we have to meet them. They will hopefully be continuing to influence how we advance those opportunities in our own company and with our colleague companies.
Well, the ADA, as we said, is 25 years old in 2015, right. And I think we would all agree it's had an impact. How would you characterize that? Would you say the ADA has been very impactful or a little impactful? What would be your rank? How would you score the ADA after implementation efforts that have occurred over the last 25 years?
I think it's been goodly impactful. I think it falls in the middle. I mean, clearly we've seen many barriers, moved out of the way. I still think we have some disincentives, within our Medicaid programs in particular, but just in our culture and our world, the big wide world out there, I think there have been a lot of advancements. I think we continue to have many more to go. I think when we look at more inclusive communities, we are far behind. So yes, we have curb cuts and we have accessible transportation in many places, not all places. We have new transportation companies that are joining our communities that aren't complying necessarily and accessible. We have housing that remains segregated. It may be accessible, but it's segregated. We have employment barriers that have been lifted, and companies are being held to legal ramifications, as well they should be. I think we should all be accountable to each other, on continuing to advance it. So lots of progress. I think without the ADA, we wouldn't be having the conversation. So, but it's where do we go from here?
So the progress is good. The disparities are of concern to you.
Yes.
Merrill, I really appreciate what you do around the country, educating employers, educating public officials, helping support and empowering people with disabilities in many cases. It's a role that in some respects I'm envious of your opportunity to meet with so many people, know so many people, and be able to influence their lives in a positive manner. So it's great for me to know you, and it's wonderful to have this opportunity today to discuss these issues with you.
Thank you. I think the company is very supportive of me and of you and of our colleagues out there, and they've met so many of us. And so I think with more people in the company being supportive and more companies being supportive of really understanding the value of, ensuring that all of our steps, all of our actions, all of our programs should be informed by people with disabilities, older adults, people who use our programs. So I think we have a lot of many more years of comradeship ahead of us.
Well, I appreciate it, Marilyn. Thank you for your thoughts. Thank you for being our guest today, and you'll be welcome back again.
I'd be happy to do this, Lex. Thank you. It's an honor.
I want to thank all of you for watching Focus on Abilities. We'll be right back with some closing words. You've been watching Focus on Abilities on HTV. I'm Lex Frieden, and we certainly appreciate you tuning in to the program. Today we've talked about employment of people with disabilities, the Americans with Disabilities Act, ADA 25th anniversary, and we've talked about healthcare issues pertaining to people with disabilities. The employment rate is a big problem, but it should improve with the rapidly aging society. Many more jobs will be open, and people with disabilities will have an opportunity to apply for and win those jobs. We'll talk about that in future episodes of Focus on Abilities. For now, I'd like to thank HTV for producing the program and you for watching. We'll be back with more Focus on another program.
Focus on Abilities was brought to you by Tier Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. And the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.